My name is Marianne, and I am from the University of Melbourne. The most recent Memorandum of Understanding signing, as Professor Yamauchi was saying in his presentation. It's been a wonderful day. I've really enjoyed listening to the breadth of research that's been presented today, and to hear the impressive array of activities of the graduate students within FHS. It is a privilege to be here and to share my own work with you all. In Australia, where I've come from, it is traditional to acknowledge our Indigenous peoples at the beginning of our presentations. So, as such, I would like to take this opportunity to acknowledge the traditional owners of the land upon which I stand today to deliver this session, the Ainu people. It is a beautiful country, Hokkaido, and I've really enjoyed my visit. This afternoon, I will present our work with Hokkaido University about team-based care for older adults. Although it's me presenting, it is on behalf of our wonderful interdisciplinary team, which also includes graduate students from Faculty of Health Sciences. So our team includes from the University of Melbourne, we represent the eye care professions in the form of orthoptics, which being straight eyes, and optometry for glasses prescriptions and general eye health, as well as nutrition in residential aged care. And then from the Hokkaido University side, we also have occupational therapy and physical therapy represented as well. In my own research in dementia, I collaborate with social work as well, and psychiatry in addition. So it's a very interdisciplinary piece of work that I'm presenting here. But the key thing is that we're all allied health professionals with a shared passion for preventive care and rehabilitation research for older adults. Our research areas include things like bone health, falls prevention, cognitive health and interprofessional learning, as well as clinical education and dementia care. And we're all educators, researchers and clinicians. And so our team maintains this threefold balance between those areas. And this is also reflected in our workshop programme. So this is our workshop programme, which has been funded by the University of Melbourne and Hokkaido University together. The title's a bit complicated, but ultimately the aim of the game is that we want to help older adults to grow old in their communities in a holistic way and an integrated way, rather than each profession seeing each person as a pair of eyes or what they need to eat. And this is captured as well in our work with a focus on students as well as people who are already qualified. We want to be reaching all levels of healthcare training with these messages. So our workshop programme, to achieve its overall aims, we wanted to bring people together around this topic of healthy ageing. Now, I say healthy in a relative sense because that also includes living well with chronic conditions. As in Australia, for example, there are 1 in 5 people who are living with multi-morbidity. They have multiple long-term conditions. So we wanted, through our workshops, to bring together allied health professionals, researchers, clinicians, educators and students in Australia and Japan around the topic of healthy ageing, and to raise awareness of the value of us all working together, researching together, practicing together to improve the care for our older adults in our communities. And alongside this, we wanted to work together to identify barriers, facilitators, but also importantly opportunities to embed knowledge from our disciplines into the individual allied health discipline curricula. So we did 2 workshops as part of this series. So our first workshop was a case study afternoon, and we had opening remarks from Professor Yano and Professor Spittle from both of our institutions from our faculties of health sciences. So in this case study afternoon, we were able to obtain the perspectives of a variety of different clinicians. So we had the medical profession represented with the geriatrician perspective, and then from the nutrition side of things with a dietitian with expertise in aged care, exercise physiology, physiotherapy, and also general case coordination were all covered as part of this workshop. So we were very, very lucky to have these incredibly experienced clinicians who were so passionate about providing high quality coordinated care. And it was wonderful to hear everyone speak and share in that passion together. But also, one of the things that struck us with this is the shared frustrations that even nowadays, there are still missed opportunities for older adults to access multidisciplinary care. And so one of the key things that came out of this workshop was actually the realization that there's a lot for us to do together. So we had over 100 registrants from Australia and Japan. Unfortunately, only 1 in 5 completed our feedback survey. It's nice to know that Japan as well as Australia have this difficulty with getting people to complete feedback surveys after events. But everyone agreed that the content was enjoyable and increased their awareness and understanding of the roles we all had together in healthy aging. And so it highlighted some similarities and differences between Australia and Japan, and that we need to collaborate. But also there was this agreement from all of the people that filled in that survey about the fact that interdisciplinary case studies should be incorporated into future teaching programs. And I'll come back to that shortly. So the idea is, could capitalising on these differences between Australia and Japan maybe help us solve problems together? Can we turn these into strengths to deploy in collaborative work? So we did identify some shared opportunities and challenges. One of the things that stood out was the opportunity to work together and combine our individual disciplinary knowledge to develop universal objective allied health assessments to support identification of risk factors for frailty. And if you were going to do a multi-component intervention that included things like exercise and support for activities of daily living and eye examinations, how would you decide what goes into that person's individual intervention? From the challenge side, we all face difficulties with access to multidisciplinary care, regardless of what country we're in. And obviously in Hokkaido and in Australia, we have this issue of rural health. And so that's important to bear in mind that that is a shared difficulty as well. And from the sort of more crunchy questions of who should be in an allied health multidisciplinary team, how do we share information and integrate that information effectively between our different expertise areas for a good patient experience? As an occupational therapist visiting long-term care, how do you find out that somebody who has lost their communication ability has a hemianopia and should be approached from the correct side? That's just an example. In terms of similarities and differences, it's also important to highlight, again, this missed opportunities to access care, and also for the involvement of our allied health professions in assessments could potentially address some of these difficulties. We also have a shared concern about social frailty and the impact of social isolation upon our health, our cognition, and our well-being. But also, there are differences in the scope of practice and availability of different allied health professions between Australia and Japan. For example, my own profession of orthoptics is endemic in Japan, but the scope of practice is much more limited compared to orthoptics in Australia. So there are differences like that. And for example, in Japan, physiotherapists deal with footwear, whereas in Australia, that scope of practice area would be covered by podiatry, which is not available in Japan. So these are some examples of similarities and differences between the two countries where having that shared understanding is important. So we decided to take this forward. If we want to work together, we need to understand how care for older adults is delivered in our respective countries. So we came to Hokkaido. We visited aged care facilities and day centres. I delivered an interprofessional education lecture to Hokkaido University students about the eyes as a window to the brain and how vision impairment can impact upon neurorehabilitation techniques. And we also ran a second workshop. So our second workshop was more focused on this learning between professions because that was what was identified as needed in our first workshop. So we had an opportunity to share our research. We had a research showcase that was celebrating interdisciplinary clinical research that had been separately conducted by our universities. This is an important opportunity for research impact internationally for all of our group, who are all comprised of early and mid-career researchers. And it allowed us to identify additional collaboration opportunities to start these conversations about interprofessional education and research and practice. So given that this is an example of us sharing all of our research, we wanted to also talk about what would future collaborations look like in practice. So we did some discussion groups with clinicians, students and researchers who came along to the second workshop in Sapporo, and the focus was on barriers, facilitators and opportunities for working together interprofessionally. Here are some example questions that we spoke about. But we had a similar high uptake of this second workshop. Again, a big variety of different disciplines were in attendance, and also many students from these disciplines too. So we had a good participation level in our discussion group after the research showcase. And the two key themes that I really wanted to highlight was this desire and perceived need to increase opportunities for interprofessional practice. And also to show that even though we're all different allied health professions and we have different areas of expertise, we're ultimately working towards the same goal of helping older adults to age in place in their communities, to maintain independence for as long as possible, and to avoid institutionalization until towards the very end of their lifespan. So that's where we're sort of coming from. And so in order to take this forward, we were able to actually reciprocate the kindness and hospitality that our team received on our trip to Sapporo, that omotenashi, by showing our research facilities available for interprofessional collaboration, such as human movement laboratories, our imaging centre, and also our teaching health clinics for a variety of different allied health professions. We've also had the opportunity to disseminate our interprofessional practice work in both Hokkaido and Australian platforms, which has been really wonderful to do. So we've been able to reach educators, clinicians, and also people from my own profession in optometry, which allowed an international dissemination of our work as well. So we've got a publication coming together soon. But I just wanted to talk about what we're going to do next, because from our workshops, it showed that there was a need to increase opportunities for interprofessional practice, but also learning and training for them to different professions to learn together and to be aware of each other's shared goals for promoting healthy aging. And so we were very fortunate to receive some additional funding from the University of Melbourne to produce a Hokkaido Summer Institute module to equip students to work in multidisciplinary teams. And so in Japan, this interprofessional education is more limited in implementation in the allied health professions and in nursing compared to some other areas. So hopefully, having the module as part of the Hokkaido Summer Institute will encourage lots of Japanese healthcare students to take part, as well as people from international locations as well. So this is just a brief overview of our planned development of the module, which we will create together. This will include a collaborative literature review using a web-based platform, so we in Japan and Australia can work on the review process together and publish that. We will also work with the University of Melbourne Interprofessional Education and Practice student community. This is students from different professions that have an interest in interprofessional practice. And we will work with them using a design thinking methodology to create the case-based learning scenarios and to design the talk content to ensure that it's realistic and reflects current work-integrated learning experiences on placement, with something for every profession to contribute. This will be supported by trained facilitators using highly effective IPE facilitator training materials developed by the University of Melbourne Centre for Collaborative Practice. And this will result in a lasting skill boost for health sciences staff at both universities to support the module going forward. And we would like to consolidate these interprofessional case discussions by filming a group of clinicians discussing these cases themselves, with help from our colleagues at University of Melbourne and Hokkaido University, who are experienced with case management. And it will be wonderful for everyone to work together on these cases. And this will also include in our talk content a session about the use of electronic health records for interprofessional information sharing and creating documentation that can be read and understood by other healthcare professions to facilitate that integration of care. And this is another thing that had come out of our workshops about this desire to improve our information sharing between professions. So that's September, that's what we're working towards. We're really excited for this next phase. I'd just like to acknowledge the funders of this work today, and also my attendance here would not be possible without a travel grant from my clinical organisation, the Australian College of Optometry. Thank you very much. Arigatou gozaimasu.